So another great assessment to do and a treatment position is to, number one, make sure that somebody's head here in a normal range of motion, and Quinn has a young, healthy neck. His face is basically making a 90-degree angle with the plane of his body, and that's normal. So when the neck is not injured, and when the neck is young and healthy with full disc space between the vertebrae, you're going to notice that the patient's head is going to fall with a 90-degree angle. In people that have cervical degenerative changes, that position might be as bad as maybe even 20 degrees, 45 degrees, but in a healthy neck. And it dovetails into another beautiful series that I've had a lot of success with getting to these muscles. That's why it's important to have an ability like the edge of your bed or a couch or a place where somebody's head can fall off the back edge, because now we're going to explore how to do some active release technique and some massage techniques that are also really valuable in treating the upper cervical spine. One of them, my favorite again, is to be able to get inside. So I'm going to extend my patient's head way back over my fingertips here. I'm using the fingertips of all, sort of 4 of my 5 fingers on one half of the neck, and I will do the same with my other hand. And I'm creating almost a little bit of a spear effect with the tips of my fingers, and they're all aligned with each other, because the skull and these muscles are very linear, they're very straight. And I'm going to get underneath. And to know I'm underneath and I'm getting deeper here, I'm going to soften up, I'm going to let his head fall gently, and I'm going to poke my fingers up into those muscles, and I'm going to get through that upper trapezius. That's the big barrier here. And remember now, the upper trapezius sometimes is a pain generator, but very rarely is the upper trapezius something that I feel like I'm going to treat. And it's kind of unavoidable. You're going to be treating the upper trapezius whether you like it or not, because it's the most superficial of the muscles. But the way I want you to think about this is to get through that and lock on, like I'm doing right now with Quinn, and hold. Sometimes you don't have to do anything more than this. This is fairly strenuous. I'll let you know that you have to really develop a little skill here of having some stamina with your fingers. But I'm going to get underneath and I'm going to push that cervical spine left and right. We'll talk about that in the next video. But for now, we're treating the suboccipital muscles underneath the skull. And to get them, it helps to extend the head.